toward the end of pregnancy, lots of people are told they need to be induced. They sign a form, they consent, they get put on a list, and they aren't really sure what they're signing up for. They've been told all the reasons they should be induced, all the bad things that might happen if they don't get induced, but they don't really know what comes next. So I have a great visual here that will show you what you're signing up for and what goes with induction. So I'll start this out with, this is a uninterrupted birth. And when you sign up for induction, you pretty much give up your choice of birthplace. If you were planning a home birth or probably a birth center birth, you're going to be in the hospital. You might be giving up your choice of baby catcher. Maybe you're transferred out of midwifery or away from family medicine. And I know in lots of areas, people don't have choices in these things anyway, but if you do, that changes. Labor is not going to start on its own. You won't do early labor at home. I'm talking about oxytocin induction here, by the way. There are some other methods, but oxytocin is by far the most common method. So we're going to talk about that. We have labor is no longer going to progress naturally. And you will be continuously monitored for the safety of the baby. Just make sure baby's tolerating the induction okay. You will have an IV because that goes with induction. And some places might strongly encourage you to wear a hospital gown. This may or may not be a thing. So these are, oh, you'll also be told no eating because you might have to rush over to the OR because we know oxytocin induction can increase the rate of cesareans. So now what usually happens here is oxytocin inductions, for some people, they're fine and straightforward. And for other people, they can be quite painful. So now they're using pain meds. Oh, when you're continuously monitored and have an IV, you're probably not going to be in the bath or the shower either. There might be exceptions to that depending what kind of monitoring equipment is being used in your birthplace. But many people will have pain medications and epidurals when they have an oxytocin induction. Not everybody, but many people. And as soon as that happens, they may be confined to the bed. Now, of course, being confined to the bed doesn't mean you have to lay on your back, but in many hospitals, once an epidural goes in, you're not going to be up moving around. When you have an epidural, you will not be wearing your own clothing anymore. And it may or may not change the support you have. I guess if you were planning a home birth, then it might. Many people with epidurals use a catheter instead of the toilet. So this birth is looking quite different. Now, with epidural use, we know that that could affect your choice of birth positions. It can affect how you bear down. It does increase the rate of vacuum or forceps. And with vacuum and forceps, we have episiotomy. Induction also can increase the risk of a cesarean birth, which can affect whether you have skin to skin, delayed cord clamping. You might get 1 minute in the OR if you're in the OR. And it can really affect the recovery. Recovery from a long labor or an induced labor can be more difficult. Certainly a recovery from a cesarean birth can be more difficult. The research shows that people who have a long oxytocin induction have higher rates of postpartum mental health issues as well. So that is what you might be signing up for with induction. And I want to acknowledge here that induction certainly does have its place. Whenever there's a reason that it's not healthy anymore for the maternal patient or the baby to be pregnant, then good thing we have induction. Throughout history, people have been trying to figure out how to induce labor, how to get the baby out. So oxytocin can be a wonderful thing if there's a good reason to, end the pregnancy and get the baby earthside. If it's being used just because of a number on a calendar, maybe there's a good reason, maybe there's not. Ask lots of questions. Make sure you understand your care. Make sure you know what you're getting into. If you are being induced, there might be higher risks, but there might be a good reason. And there are still lots of things you can do to have an empowering birth. Sometimes our choices become more limited. So subscribe to my channel. I'm Angie the Doula, and I teach all kinds of prenatal classes and train doulas, do all kinds of things to help make birth and pregnancy and postpartum more empowering. So thanks for watching.